Hello, thank you consumers and potential patients for coming out today. I attended our educational patient webcast. My name is Gilliam Elliott. I'm the membership coordinator here for the Medical Tourism Association. The MTA is the first international nonprofit association made up of hospitals, healthcare providers, medical facilitators, and other affiliate companies and members with the common goal of promoting the highest level of quality of healthcare to patients in a global environment. The Medical Tourism Association also hosts the first ranked, or a number one ranked website, medicaltourism.com. We send thousands of international patients and consumers to healthcare providers such as our members. Usually medical tourism is proven to save patients a tremendous amount of money. This system is filled with exceptional medical tourism businesses as well as non-exceptional tourism businesses, just like any other industry. Patients can rest assured that we advocate on their behalf and hold our MTA members accountable for and adhere to the highest healthcare standards available in the industry. This is why patients find it refreshing using our MTA members to do their treatments with. Today I have three experts in medical tourism and also pharmaceuticals. Bill Cook, he'll be covering the medical travel experience. Adele Soleil will be covering the pharmaceutical section of the webcast. And last but not least, Diana Cota will go over the safety and quality of care and how patients should study their pharmacists before they go out, or their healthcare providers before they go out and use them. First, I would like to introduce you to the first speaker, Adam Soleil. Adele, if you'd like to go ahead.
So I'd like to thank you very much for giving me this opportunity to speak to you today. So we were talking in regards to our presentation today. We will be talking about access to medication and prescriptions for less. And I've geared this presentation today to basically anybody who's a patient, a hospital, a clinical facility such as a fertility clinic, government agencies, anybody who does clinical trials. So there's something in this presentation for everyone. I'll be taking approximately the next 15 minutes of your time, so I really appreciate you listening to me for that period of time. To kind of tell you what we're going to talk about today, we're going to do a short introduction. I'm going to tell you a little bit about myself. I'm going to tell you a little bit about the company that I'm a director for, which is RxSource, and what our role in the Medical Tourism Association is. I want to talk to you a little bit about medication safety and how that applies to you as a patient, a government agency, and a whole host of arenas. And then I want to give you a little bit about the background of the pharmaceutical industry so that you can understand how all this fits into place. And then for our patients, I want to give you some aspects of how you can look for verification of pharmaceuticals and 5 tips that can potentially save your life. And then lastly, I will cover what RxSource is and the services it provides. And then we'll do a Q&A after all the speakers have finished for the day. So with that, I'd like to get started. As I said, I'm a director of medical affairs. I'm a pharmacist. I graduated in 1993, and I've done a whole host of TV, radio. I've worked as a consultant. I've worked as a community pharmacist. So I have a lot of experience in the industry, and I've also had a lot of background. But you know, one of the things I always start my presentations with is what's the most important thing to me and the most important thing to most patients, which is, you know, we all have kids, and they're very small at one point, but then they grow into something that's much larger. And every presentation I do, I try to refocus, and my kids are the most important thing in my life, and I think that's something that I always like to share with people. That's my son Ariz and my daughter Arya, and we won't tell, you know, who's harder to get, whether it's the Dolphins or my kids. So in that, I would like to tell you a little bit about what RxSource and how it fits into the medical tourism industry. RxSource is a corporation that was created over 10 years ago and has had a lot of experience in the industry. We're basically a world leader in pharmaceutical procurement. So what does that really mean when you talk about procurement? Well, procurement means that we get medications from all over the world, whether it's North America, South America, Africa, the EU, Australia, the Far East, and we do it in a safe, effective manner. We are GMP certified, which means that we basically follow good manufacturing practices. And in Canada, we follow very stringent guidelines with Health Canada certification that we have through all our wholesales. And we follow a very stringent guideline with what's called SOP. So there are standard operating procedures which take place in any facility that we deal with. So why is this important? Well, it's important because our role in the medical tourism industry is to basically fill the gap with a safe supply of medications. So you have hospitals, you have us, which is right in between as bridging the gap, and then you have the patient. And that's really the importance of our role. And why is that important? Well, we all know that counterfeit is a big business. Now, when you're talking about a purse, yeah, you know, it's not going to kill you. It may kill your wallet. But when you're talking about medications, it's very, very different. And if you look at these two medications, for example, and especially if you're in North America or in Europe, you never ever think about the fact that when you're visiting a pharmacy or when you're getting a medication, is it real or is it fake? Now, a purse may kill your wallet, but fake medication can kill you. So it's really, really important that you have a safe supply of medication wherever you go and wherever you're getting your services as a consumer. And some of the things that are really important and the questions that you should ask of the facilities that you're visiting is, where are they getting their medications from? What certifications are they applying to the hospital, the government facility that you're going to? And what type of experience do they have in this? Are they following the proper regulatory affairs of not only their country, but of an FDA facility or a Health Canada facility to make sure that they're properly registered and they're actually properly transferring their drugs and their medications? And are they using validated logistics? So what does that mean? Well, that means that if you have a drug, for example, let's say it's a cold chain drug, which should be stored at a specific temperature. Is it coming in as a cold chain between 2 and 8 degrees? Are they actually following those procedures? And this not only transcends into medical supplies, but you should be asking the same questions of your surgical supplies and all the other everyday supplies that you get, including bandages and so on and so forth. So why is that important? Why is the safety of medications important? To understand this, you actually need to understand a little bit of background on the pharmaceutical industry itself. It's big business. When you look at how much money it costs to bring a drug to market, it can be anywhere between $800 and $1 billion to actually bring a drug to market from the R&D costs and the marketing. So drug companies put a lot of money into making sure that they're going to recover those funds. And the way they do that is by putting patents on their medications. So that's important. And to maximize those patents, they then will look at countries and set drug pricing. So for example, you've probably heard about a lot of people that have come down to Canada to get their drugs because they're cheaper. And let me give you a little bit of an example of this. So let's say there's a drug called Celebrex, which some of you may be aware of. It's used for arthritis. It's approximately $2 in the United States because that's what the market in the United States will bear. That's the price that the drug company has set for the U.S. In Canada, it's approximately half that cost. So there's almost a 50% savings. Now, what's the reason behind it? Well, in Canada, we have what's called Medicare. And because the government actually sets the pricing, our pricing is a lot lower. Now, is the drug in the United States and in Canada different? Absolutely not. They actually come out of the same factory. They're sent out of the same boxes. The packaging may be a tad bit different. They look identical, and they're the exact same drug. But there's a 50% savings because Canada has Medicare and the U.S. doesn't, and that's what the market will bear. And in other countries, those prices may be higher, may be lower, but that's how drug companies maximize their profits. And they spent a lot of money getting that product to market, so it's important that they have the ability to recover those funds. So within that, what happens is when these patents expire, that's when generic drugs are created. So when the patent for Celebrex will expire, there'll be a generic and the prices will tend to drop. So why is all of this important? Well, because people always want to make the most money they possibly can. That's how counterfeits enter the market. So it's really important to ask those really, really simple questions that can kind of save your life to some degree and make sure. And these are some of the tips that I've kind of come with. One of the things I really want to emphasize is that we're not an internet pharmacy. We do not ship to patients. That's not our forte. So these tips that I'm giving you are basically just to let you know what you should be looking for no matter where you go somewhere else in the world, if it's not a first world country, to make sure that you are asking those questions. So the first question you want to ask is, where is this medication from? You know, is it from a first world country? Is it from India? Is it from China? Because that should set off, you know, some red flags for you if they're from other countries that you aren't aware of. Now, that's not to say that those countries have bad medication, but a lot of the counterfeits tend to enter from those countries. And you really have to do your research on the company that's made that medication. So it's important to actually do the research on those companies and make sure that you're actually asking the right question if it's come from somewhere else in the world. And, you know, just Google a company, and it's really, really easy, and see how big they are and see if they've had any lawsuits or things of that nature. The next question is that if you're on a site, is a prescription required? This is kind of an important thing, especially living in the first world, is that you want to make sure that the other side is copacetic. If they're not asking you for a prescription, that's a little bit of a red flag, and it should make you inquire a little bit more and dig into the company a little bit more that's supplying you the medication. Thirdly, is it branded or is it generic? Now this is important because if it's a branded product, obviously you know there hopefully is some quality control, especially if you're buying it in the first world. If it's generic, it could be made anywhere, and you want to make sure that, you know, the brand that you're getting, the generic brand, is copacetic as well. So important to ask that question. And then when you get your medication, if you're buying it from elsewhere, you know, does it look the same? Now there are brand variances that happen, but you know, those are questions that you need to ask the pharmacist on the other side. Does it smell the same? You know, if it smells like alcohol or it smells like bleach, those are, you know, common sense things that set off and say, hey, you know, there's maybe an issue with this. And then lastly is, you know, if you're getting it in a sandwich bag, that's probably not original packaging. So those are kind of important things that, you know, on a day-to-day basis should set some red flags off for you. And, you know, the old adage goes that if something sounds too good to be true, especially in terms of, you know, if something costs $10 and you're buying it for 2 pennies, sometimes you do get what you pay for, and that should help you make the decision on whether you want to keep going on with that or not. So in terms of, that's to give you some tips of what you should do as a consumer. So what do we do as Rx Source? So we actually supply, like we said, we deal with hospitals, government agencies, clinical trial facilities. We do comparator sourcing. We do named patient and compassionate care. And what is that? Well, that's when you have, you're living in a different country and there's a drug that you would like. So for example, if you're living in the EU and you need a drug, something like Cripolis, which is very expensive, it's only available in the United States, but you're in the EU and it's you're, you know, stage 4 cancer, and that's a drug that you require. You would apply to your government agency, then they would contact us to supply that drug for you on a compassionate basis. So we do the logistics, we take care of all of that, we bridge the gap to get that product to you. We work with clinical trial facilities to actually provide medication for them. We also provide comparator sourcing, which means that they may need a branded product when they're taking a product generic to have a comparator. We do validated logistics. Well, that's actually a really, really important part of what we do. We make sure that, you know, drugs travel in the temperature zone that they're supposed to be. And if there's any excursions of any sort, we have a medical department which will then look and say, you know, is that drug still valid or does it need to be thrown out? And that's really the most important part, which is the part that I take care of. So obviously it's the most important part of what we do in our company. And then secondly is we also work with governments and hospitals to work on tenders. So that gives you a little bit of a background of what RxSource does. It tells you a little bit about what, as a patient, you need to kind of know, and how we fit into the medical tourism department. I know my time's up. We'll be taking some questions afterwards, after I believe the next session or the session after. So I'll be happy to answer any questions that you have. I'd like to thank the MTA once again, and thank you for listening. So thank you very much.
Good morning. This is Bill Cook and Gloriana Gomez. Good morning. This is Bill Cook and Gloriana Gomez here, Medical Tourist Costa Rica. We're actually here in Clinica Biblica Hospital in Costa Rica. Our company is called Medical Tourist Costa Rica. Well, first, we'd like to thank the MTA for organizing this important webcast. Valuable information Mr. Solet presented and the other presenters. So our company we started as a international office inside a hospital Clinica Biblica. For many years, we're working, just assisting patients coordinating their medical care in Costa Rica. A few years ago, we expanded to work with other hospitals, so it's our own company, and we work with patients, work with companies, sending employees, facilitators, sending patients down, so pretty much coordinate the care in Costa Rica for these patients. Gloriana, she's a patient coordinator, one of our most experienced patient coordinators, dealing with every single day, to deal with assisted patients, probably thousands of patients. And so she's going to speak as well, and she's a lot of practical experience, and she's seeing patients every day.
I'm glad to be here. I hope that everything that we say here and all the other presenters say will be helpful for your decision-making process.
Okay, so we got quite a bit of material to cover in a little time, so we're going to start right now. Let's see if I get the slide to change. Okay. Our presentation is Explore Quality and Affordable Health Care Across Borders. So we're going to cover 4 topics: 7 mistakes that can ruin your medical trip if you're a patient. What is a typical medical tourism experience like? And how much money will I save? And should I use a medical tourism facilitator? So let's look at the 7 mistakes. Number 1, making low cost or cheap procedure price your number 1 priority. Of course, we know that most people, a lot of people, especially the U.S. and some developed countries, are looking for low cost as one of their top priorities in terms of choosing a destination. But we really want to talk about the importance of weighing other factors as well, not just low cost, but looking at other things that are very important when you're making that decision.
Like Mr. Saleh said in the previous presentation, sometimes when you focus on cheap or when you focus on the price, then you may get what you're paying for. So make sure that you're not only weighing the cost, but also other things such as the surgeon's experience and the facility that you're going to go to. Make sure that they have the accreditations, that they have everything that you may need to feel safe, that you're putting your health or your loved one's health in someone else's hands. Also, getting testimonials and feedback from other patients, people that have been to that country, that have been with that specific doctor, that have been to that specific place, can give you more information, shed some light about what you expect when you come or when you travel abroad.
Yeah, don't be afraid to ask for testimonials. If a hospital or a facilitator can't give you testimonials, it's obviously a red flag.
Also take into account that testimonials may be, or getting testimonials may be a little sensitive for some patients. So they're there and ask for them, but maybe give them 1 day or 2 so that they can get all the appropriate permissions or permits from whoever's going to be giving their testimonial, or even email address or telephone number so you can have a conference call and make sure that you get some more information about your medical experience.
Yeah, there's safety at the destination as well, finding out about that. Proximity, I mean, if you're going you're traveling to the U.S. for a knee replacement, hip replacement, I mean, how many hours are you willing to travel? I mean, there's conditions such as deep vein thrombosis and different things you got to be aware of. So proximity is definitely a big factor. Also language and cultural affinity as well.
Keep in mind traveling to a different country where, we're going to cover this a little bit ahead, but make sure that whoever is going to be dealing with you, that your surgeon, that your nurses, everybody that's going to be taking care of you directly, that they know how to speak your language. Yes, of course, there may be some barriers. There may be a little bit of grammatical errors, but as long as you can get through with the message, that's the best thing.
Exactly. Okay, number two, not be honest when submitting medical information to the hospital or the doctor. And this is critical. I mean, usually the hospital or a facilitator, they will send you a medical questionnaire you're supposed to fill out looking at the procedure you want to get done. So, I mean, if for example, you smoked or smoked in the past, it's very important to let the hospital know. Did you intentionally underestimate your weight? Did you omit a previous surgery? Forget to come in. We had a patient a couple of years ago who come down for it was either bariatric or a gallbladder type surgery, and he came and he didn't mention that he was an alcoholic, and he was at the recovery retreat before the surgery drinking. He had about 6 packs of beers, and so when he came to the hospital, they did some tests. They found out he had big problems with his liver, and they had to cancel the surgery. So it's very important to be honest.
Don't be afraid, because if you do your research and go to a trustworthy facility and physician, they will probably have an interdisciplinary approach to your procedure. This means that not only you're going to be in the hands of the surgeon, but also maybe an internal medicine specialist that will be able to catch some things in advance. So feel free to put whatever you feel the doctor needs to know about your case in the medical questionnaire, because this will make sure that they have the appropriate protocols to care for you before the surgery and after the surgery.
Okay. Number three, unwilling to press the doctor for information that will allow you to evaluate his or her abilities and expertise. I mean, we feel it's very important to try to get a conference call with the doctor. Do everything you can. I mean, talk to the hospital, if it's a facilitator. You want to talk to the doctor, you want to gauge his level of expertise, his language abilities, I mean, how many procedures has he done. So don't be afraid of qualifications, basically.
You should also ask for the references. You should ask for the patient testimonials, videos. Even if whoever you're dealing with is willing to give you an email address or a telephone number so you can call the patient directly and ask more intimate questions maybe than what you may be able to see in an edited video from the facilitator or from the hospital, wherever you're going to, then it would be best, because you get a candid view of what the patient's previous experience was. And also ask for an explanation of the treatment plan. Why? Because if you do your research, you know that, for example, for hip replacements, there are different approaches. The anterior approach, posterolateral approach, why the doctor chooses to do this one or that one with you or with other patients. So it's good that when you do your research, you gather all these details, and when you have the conference call with the doctor, you will be able to confirm or cross and match what your wishes would be, or if you choose to follow the doctor's lead, it will give you more trust about their experience.
Very good points. And as we did at the language part, I mean, talk to the doctor, make sure they can understand you, that you can understand. I remember several years back we had two patients, mother and daughter, coming for surgery, and we had a doctor, general doctor, was a good doctor, a very good doctor, but didn't speak English very well. I mean, once in front of them in the hospital, everything went okay. But the doctor, everything's okay. I guess we get some little feedback back here. But when they spoke to the doctor on the phone, the doctor just couldn't understand them well. They couldn't understand the doctor well, and they hung up. About an hour later, they called. They said they had to cancel their procedure, and we knew the reason. They said it was some reason or other, but we knew it was because of the doctor. The conference call, the doctor really couldn't communicate well. So again, the fluency part in your language is important. Okay, 7 mistakes. Continue. Number 4, not having all important information from the provider or the facility in writing. So, I mean, what are we talking about? Price quotes in writing, and we understand what a price includes. I mean, does it include your transportation? Does it include preoperative exams? Does it include, you need to know if implants, if you have a rehabilitation, and those type of things.
Anesthesiologist, and this not only for your medical travel, but even when you get the quote back in the States, sometimes you get a little misled if you make sure that if you don't have all these details in writing. So make sure that you have these, so you are going to be able to compare accurately what your medical experience would be in your I don't know, home country, or how much savings would you get if you travel abroad? Who will be financially responsible for potential complications? Of course, they may be rare in a lot of procedures, but it is a surgical procedure. So post-surgical stress, high blood pressure, some other things may arise. So in case that there is extra medication, more time in the OR, who's going to take care of those details, the important details? Also, ask for photocopies of the way, everything that you will be signing when you travel, so that you can have an idea of what kind of information you need in advance in order to sign those papers with all the information that you need. Description of the legal recourse that you would have if needed. It's good for you to know what kind of tools do you have for your medical travel inconvenience. And it's good for whoever is setting up everything for you for your medical trip, that they should send you an itinerary with tips, because you don't know maybe how far in advance you need to be ready before your pre-op or before your surgical appointment. You don't know if you have to be 1 hour or 2 hours before an admission. So make sure that you get all those details prior to your arrival.
It's very important. Number 5, and this is very important. I don't think people in medical tourism talk about this a lot, but bringing the wrong companion, I think, along to your procedure. I think we're kind of dealing every day with patients. Can maybe talk a little bit about this?
It's just that you have to put yourself in the shoes of a post-surgical patient. Have you ever, or whoever is going to be with you, have they ever helped you with your shower? Do you feel comfortable enough to ask them to maybe assist you getting up and going to the bathroom? You have to think about personal things and who's going to be taking care of you on those situations. Also, that person has your best interest at hand, first of all, because you're going to be the one needing the assistance. We have had patients that, for example, they quit smoking 1 month ago because they were, I don't know, working for the surgery. They were putting themselves in a very healthy situation, and their companion smokes. So maybe they're away because they were smoking. They were away before an important appointment. They were away during an important procedure because they were smoking. Some others, they have chosen to take this as a vacation, and the patient is at the hotel room needing assistance, and the person that's going to be assisting, it's away at the beach. So make sure that the person that you're going to be bringing is educated about their role as companion, that they know what's expected of them from you and even from the doctor. Also make sure that they're there to support you. At this moment is a moment to be a little selfish. Okay, it's all about you and your medical experience and your proper recovery. So make sure that you think about that and that they will be able to support you physically and emotionally. And then please make sure that that person is going to be putting your needs ahead of theirs.
Very good. Not allowing sufficient time to recuperate before traveling home or getting back to work. I just want to talk as well.
It has been proven by some of our corporate clients that patients that come to a really good program of medical tourism, they return to their jobs before time than if they had the surgery in the States or in their home country. Why? Because you're focusing directly on your recovery. You have physical therapy brought to you. You don't have to make meals. You don't have to fix sandwiches for your children. You don't have to do all those things. So what's the deal? That you focus on recovery while you're down here. So you recover easier and you go back to work sooner. But the thing is that some people try to push it. They try to do physical therapy a little bit more expensively because they want to be better sooner. And the thing about doing research and trusting whoever is going to be caring for you, it's because you need to follow their lead. So they say that you have to slow down a little bit, then slow down a little bit. Don't push it.
Very good points. Number 7, the last of the 7 mistakes we have here, not willing to experience and adapt to new situations and new cultures here. So basically, medical tourism in most hospitals are seeking to attract international patients. So they've got great facilities and technology. The care they provide is outstanding. I mean, patients that come down here to Clínica Bíblica Hospital are always amazed by the cleanliness of the hospital, just the modern facilities and all that. But at the same time, I mean, you got to understand you're traveling to another country, so there's going to be a different culture, there's going to be a different language, different customs. You're going to be aware of these and be maybe flexible. I mean, we've had I know patients we had from a corporate client that everything had gone well with the hospital, the surgery perfectly, but they were complaining about the food. They wanted a Taco Bell. I said, we don't have any Taco Bell. How was that?
They wanted real food.
Real
And when
food.
we asked them what kind of real food they wanted, they said Taco Bell. So
So,
we were able to accommodate 1 or 2 meals, but it was too late. It was already after the post-op. And
yeah, we do have Taco Bell here. By the way,
but we're very accommodating, but the doctors also have stated some, I don't know, pointers about the diet. So it is important for them to follow that lead. Please, if you need something specifically, if, for example, like we were saying about the companions and everything, they should know your likes and dislikes. So if you don't eat with onions, if you don't like water, you only carbonated drinks, all those things need to be addressed so that you're comfortable. There are 3 things that we want our patients to be: well fed, well slept, and without any pain. So good communication is vital, okay? But if you expect everything to be North American or the American way, you may find a little disappointment along the way because not everything is like that. I'm not proud to talk about this, but it's good for the patients to know. For example, in Costa Rica, there is one thing that we call pico time. It comes to a point where the Costa Rican will tell you that they're around the corner and they're a mile away. If they tell you that they're going to be there in 10 minutes, you can go to the washroom, start reading a magazine because it will be 20 or 30 minutes. An educated wait will help you ease the process and understand better what your medical tourism experience is going to be like.
good points, Brianna. So we got through the 7 mistakes can ruin your medical tourism experience. Now we're going to look a little bit about the patient experience, just some of the stages quickly of the patient experience. So what is a typical medical tourism experience like? For patients, you as a patient, I mean, these 5 stages are typical. There's a research stage. You're coming in, you're maybe getting online on Google, you're looking for hospitals, or maybe for a facilitator, you're looking at the different hospitals they're promoting, maybe you're seeing on YouTube a doctor talking about the procedures they're offering. So that's the research stage. Maybe then number 2 comes the inquiry stage. There you get to send an email maybe to the hospital or facilitator, maybe place a call. They'll get back in touch with you. They'll ask what you need. They'll send you a medical history questionnaire. So you go back and forth in that process. And once you make a decision, it comes to the number 3, the planning and preparation.
It is very good that you think about the whole experience. Not only think about your preoperative process, or who's going to pick you up at the airport, but also everything else about your recovery. Who's going to be caring for you at the hotel or nursing recovery center? Who's going to be, are you going to be leaving with your medications? Who's going to pick you up at what time? At what time is going to be the post-op? Make sure that you have everything planned out for your experience or for your trip. So that way you're going to be well prepared and know what kind of questions to ask. Also, number 4, admissions and treatment. Make sure that you bring all the documents that you need for your admission. Make sure that you bring your passport or any kind of identification because they will ask for it. If you need to inform your credit card company about a large payment that you're going to do abroad so that they know that it's not fraud, let them know. And so that you won't be with all the anxiety of the surgical process and also having that additional stress on top, thinking about if the money's going to come through, if everything's going to be paid for. And then focus on your recovery, okay? Make sure that all the planning and preparation helps you out so that you can have a good recovery process and make sure that you have a successful outcome.
Yeah, in most cases, just to add on, the recovery process, typically in most countries that I've been to, you'll be in the hospital depending on your procedure, or maybe outpatient, maybe a day or 2. Then from there, you'll go to your hotel. You'll spend most of your time actually in your hotel. But in some countries, I know India is typical, the patient will stay in the hotel the whole time. Just be aware of that depending on where you're going. Okay, very important. How much money will I save in medical tourism? So here's a chart here. I mean, basically, on average, depending on where you're going and depending on what procedure you're looking for, it can be anywhere from 40 to 90%. I mean, rule of thumb is the higher the cost of procedure in the U.S. or the country you're at, the more you'll be saving. Typically like a knee or hip replacement in the Clinic of Biblical Hospital here, maybe around $13,000, $14,000. In the U.S. can be as much as $40,000 or $50,000. I know there's other treatments for fertility, treatments that people are looking for. It's not allowed yet in Costa Rica, but in other countries, fertility is a big drawer of medical tourism. But here in the chart, you can see just some typical prices from different countries: India, Thailand, Singapore, Costa Rica, Mexico, and Korea. So another rule of thumb that we've heard from people is when you're getting a procedure done, you got to think not just of the procedure cost, but also of the flights, the accommodation, and all that. So typically, you should try to, for most procedures, if you're not saving at least $5,000 compared to the price at home, it may not be worth it. Anything else wanted to add?
Think about the whole experience, because it's not only about the surgical price, but think about the flights, think about the hotel or recovery center, think about the medications that you need, or any other side services, okay, so that you can put together a complete package and know how much your savings will be.
Yeah, most hospitals a lot of hospitals and medical tourism will provide an all-inclusive package price, which includes a lot of times the hotel, the doctor's fees, hospital costs, rehabilitation, things, but just make sure about that and what's all included in these prices. So the last point we're going to cover quickly is, should I use a medical tourism facilitator? Like I mentioned, we work both as a hospital and as a facilitator, and so we got a few points here. So what's the definition quickly? Medical tourism facilitator, and have different names: healthcare facilitator, medical tourism agency. It functions as an intermediary or primary point of contact between patients and medical care providers. So basically, they're an intermediary. The patient will contact them. They'll get your information, they'll send it to the hospital, and they'll have relationships with different hospitals, maybe in one country or several countries. What are some advantages?
As in everything, there are good points and bad points of your choosing, but advantages of using a medical tourism facilitator: it's a one-stop shopping. You can ask there about everything. You can, for example, there are facilitators that have contacts in several countries, so you can get information about several countries at the same time, several facilities, several kind of procedures, and also you can ask about lodging and aftercare and everything else. So you can ask the same questions just to one person. It will be a little bit less messy. You can also make sure that these people that you're talking to have already established relationships with other hospitals or doctors, or that they have already been working with patients in the past. So you can ask for references. You can ask for the accreditations, and you can also kind of assure that they have already been to those hospitals, that they already know the quality, and that's why they're promoting it, because it's worth promoting, okay? And also, having a medical tourism facilitator will kind of guarantee that you will find someone that speaks your language every step of the way, at least in the important areas. I'm not saying that the security guard at the parking lot that you're going to be parking will be able to say hello and speak fluently, but at least your nurses, your medical care staff, the coordinators, everybody that you will find along the way will be able to assist you. And also, they will be able to provide the information that you send out, your health questionnaire, pictures in case that it's a cosmetic surgery or other things, to the appropriate people, to the right people, to the doctor, to the nurses, so that they know about your case in advance and will be able to give the appropriate estimate treatment plan. So you know that you're not spreading your information all around, so you just send it to these people and they will be able to send it to the point person.
Yeah, and some potential disadvantages. Quality of service may vary significantly, one facilitator or another. I mean, you can go to a website and it can look great, but you don't know what's behind that. So you got to really dig in, and we provide some recommendations in the next slide to that. There may be a bias towards the destinations. The facilitator may have just gone to one country and maybe just dealing with one hospital, and that's not bad necessarily, but if you're looking for a procedure, maybe that hospital isn't the best one. I mean, so that could be an issue there. So ideally, you want to have a lot of options. I mean, using an intermediary increases the possibility of miscommunication or errors. That's a possibility. If you're passing information back and forth, there's more of a chance that something like that could happen.
And if you have a lot of questions, it is good for you to try to put them in one single email or in one single conversation, because this way you can keep track of what your requests have been in a neatly and ordered way, so that you know which questions have been answered or not. So, I don't know, try to pre-plan before you start contacting everybody.
And then there's a potential for paying higher price. I mean, some facilitators may have negotiated with the hospital a discount, so you may not be paying, about the same price as you would if you went directly to the hospital. Some have commissions involved or different things. Some may be charging a fee. So you got to be aware of it. You can ask
the facilitator about that. So if it's more, it could be more expensive, but if it's a good facilitator, I mean, they provide a good service. They're helping you. You got the contacts. And they'll save you a lot of work and time. So just to end with this last slide, just some recommendations. Ask the facilitator. If you're working with a facilitator, ask them point blank why you should use their services, and have them articulate the value they provide. I mean, what type of services, what makes them different than another facilitator. So you really get down to that. Have they visited? That's important. I mean, you mentioned one of the advantages is that they have contacts and visited the facilities, they've vetted the hospitals, but maybe not all of them have. So you really need to find out if they've visited the facilities. I mean, they talk to the doctors, they have the doctor CVs, so what kind of relationship they really have. Do they have an agreement or a contract with the hospital? How many patients have they facilitated in the past?
It is good to know this amount or this number because it will give you some ideas of how much experience they have in the medical tourism field. And also it will give you an idea of, it will give you the opportunity to ask for the phone numbers or email addresses or watch videos about previous experiences for your own inquiry process and investigation process. Ask to speak to past customers. That's one of the things that we have been continuously saying during this presentation. Also, check with accreditation entities like the Better Business Bureau or other ones, so that
The
you
MTA
know,
as well.
the MTA, so that you know that you're dealing with people that are professionals in the field. Also, it is very important, as if you get everything in writing for the package that you will be paying for, also ask in writing the terms and conditions so that you know what to expect, so that you know who cares for additional costs, who or what kind of, if they ask for a deposit, is it reimbursed, will be reimbursed in case of cancellation. All those terms you need in advance so that you know what to expect.
Yeah, ultimately you need to feel comfortable with the facilitator, if it's a facilitator or a hospital. In our case, and I know with Doriana and some of our other patient coordinators, I mean, it's one of the keys, talking to the patient, understanding their needs, the patient building trust with the facilitator or the hospital. So it's very important that you feel comfortable with the person you're dealing with before you decide on your medical trip. And that's pretty much, I don't have any last words?
Yes. We understand that there's a lot of anxiety when you start researching about going abroad to get medical treatment. So like Bill said, please, create a bond of trust to whoever you're going to be putting your health in whoever's hands. If it's the surgeon, if it's the coordinator, make sure that you feel at ease with the whole idea and with the process. Choose who to share it with. Sometimes that's important. So, but we'll be here in case that you have more questions.
Thank you very much. I know we're in a little over 15 minutes. That's Costa Rica time, but we'll be passing the next presenter. We thank you for the MTA for this opportunity.
Hello, good morning. My name is Diana Cota. I'm the International Patient Coordinator to Amateur Hospital in Mexicali. And it is on my pleasure to present 5 important points that a patient should be aware before taking the decision on traveling abroad for medical services. Okay. What should I be looking for when I choose for a medical provider? What we see that in our experience, the most looked one is the cost. Why is it the cost? It is because if you're traveling abroad to have medical services, you have to save, and we totally understand that, and we usually make very, very cost affordable packages, so the patient can beat their prices at home and then have a substantial saving. Technology. A patient should always look for the best technology available in comparison to whatever country they're from. For example, or for instance, if a patient travels from Canada, Europe, or the States, they shouldn't be looking for technology under what the JCI or what the international system is is having. So, meaning this, in our hospital, we always compete, not to the other hospitals in Mexico, but we always compete or try to get equal technology as in the States. And I'm talking about La Jolla, Dallas, that kind of hospitals and that have edge technology. Effectiveness and prompt treatment to patients. The patient doesn't want to be in a waiting list for a hernia surgery or for a plastic surgery. And why is it this? Because we know and we are aware that in your countries you're having long waiting times for having a procedure. So what you want to do is to try to make sure that the hospital can feed you in at the time that you want your surgery. Of course, most of the travelers, medical travelers, come for pre-scheduled treatment. These are not emergencies. This is very important. A patient shouldn't be traveling abroad for an emergency service because the outcomes shouldn't be as good as they should. Of course, in a big hospital, we are always prepared to attend emergencies, but the traveler, it's not on the optimal conditions to have the treatment. So prepare with plenty of time in advance and make sure that you are not on a waiting list. The only exception would be if you want a certain doctor for a certain procedure and you want to wait until these doctors come back or have a time. However, as I said, this is not emergency service. This is traveling for pre-scheduled treatments or surgeries. The care and warmth. We are all aware that lots of our patients travel and they want to make sure that they're going to feel like at home or better than at home. So the care and the warmth provided by all the people involved in their treatment is a super important fact. And I repeat this, is a super important fact. Why? Because this makes a huge difference in how the patient feels, how the patient is feeling that his medical treatment is being conducted. And last but not least, the accreditations. The hospital that you are going to be traveling to should be accredited either by the local or national health instances or international. When we talk about international travelers, then you want an international accreditation. So to us as a medical provider, it is very important to have not only the hospital accredited, but our doctors. You should be looking for accreditations not only for the hospital, but for the doctors who are going to be in charge of your life. Next one, please. Okay. How can I be sure about the foreign physicians' qualifications and experience? It is very important. On these times, we have the social media. It is very important for you to reach on the internet and find out reviews on your doctors. Make sure that your doctor has the proper accreditations. Make sure that he is board certified in your country, and sometimes they can always show information on their additional trainings, courses, and certifications from other locations. Here in our hospital, since we are in a border town, it is very common that our doctors travel and have internships or fellowships in the States. So make sure that your doctor is credited by either the American instance, the Mexican instance, the Indian instance, whatever you're traveling. So that's going to give you a super plus. If your doctors went and have special trainings to other countries, well, it is definitely a plus. Next one, please. And related to what the rights of a foreign patient are, well, you have to choose to have to decide on whether to have or not the treatment proposed by the hospital or the doctor. This is also called as informed consent. To have a second opinion by another physician, sometimes you just don't feel the right sense, and that's human. We always offer the second opinion when a doctor is not giving you the feeling or the that sometimes you just don't feel it. So you have the second opinion to be checked by another physician. And, of course, to be treated with dignity, respect, and confidentiality. And right here, it is a very important thing that your information will always have to be confidential, and you must be treated like a human being. You're not a patient. You're a person. You're not just a person traveling abroad for medical service. You're a human being and have to be respected as a human being. And I don't know if we have another one there. Okay. And this is who's going to be with me during my medical stay. On Bill Crooks, we heard that you have to have companions. What about patients traveling abroad by themselves? Well, it is the hospital's responsibility to make sure that you have a companion, or if for some reason you cannot have a companion, then it is the hospital's responsibility to provide you a person who is going to be in charge of you during all the process. At Almater Hospital, our medical tourism staff will be always with you from the very first step that you get into the airport or the parking lot or whatever you come to until we put you back on the same place that we received you. And why is that? Because we know that sometimes when you're coming to receive medical treatment, it is very important for you to have a second person with you, because medical words sometimes could be confusing. So we make sure that we are there for you since the very beginning until this. Even if you need an ice chip cup, or if you need the prescription to be filled, or if the doctor wants to tell you something and you were asleep, we are going to be there for you in one way or the other. We always make sure that we provide also a phone, because sometimes you cannot be just there for 24 hours, but at least you have a phone so you can call the coordinator at all the time. Every single detail from starting to the end, meaning paperwork, pre-ops, quoting, hotel reservations, arrangements for even arrangements for dinner or breakfast or lunch, because if you came for a surgery, then you cannot have the same food intake that you were used to. So we always make sure that these single details or these special details are arranged for you. It is very important to you as a patient to make sure that someone is available for you 24 hours, 7 days a week. Even if you're gone home, there's someone who must be aware on you. Just even for simple questions like, I don't know if I should sleep on my back or my hip or my upside down or whatever. So there has to be someone on the hospital side to make sure on all your wellness until you're totally recovered. And I think that was the last one. I don't know if there's questions or
We need to.
Hey, thank you so much, Diana.
Thank you,
And also, I also want to thank Adel and also thank Bill for the great presentations. I mean, I've been in the industry for a while, and there's a couple of things that you guys brushed up on as well that I found interesting as well. I want to go over a few questions. This question goes to Diana, and also Bill can touch on it as well. Someone asked about the language barrier. They just said they wanted more information about it. I mean, how does it work? Maybe they're from India, maybe they're from Russia. How do they assure that when they go to this hospital, somebody there, or when they use this facilitator, somebody at that facilitator business can communicate with them throughout the trip, not just beforehand, but also during the trip and when they get to the hospital. So I think, Diana, I think that's a good question for you. I also think it's a good question for Bill as well. Maybe you guys can both address that.
this is a very, very, very important and tricky question. You must be informed by the hospital or the facilitator, if you have one facilitator, that there's going to be a translator or there's bilingual speaking personnel. In our experience, we have translators, but we also, being in a border town, it is very easy to have bilingual staff. So if they don't, and then we have the accommodations of the people. If they, and this is education for our personnel, if they don't speak English, they'll get you someone. But during the travel, there is these special terms during your travel that you just don't, there are some things that you cannot control. Usually air flights and hotels, they have bilingual personnel.
Yeah, this is Bill. I mean, yeah, that's a great question. I think Deanna answered it very well. I mean, if the language barrier, like you said, I mean, an important thing is either through a facilitator or if you're talking to the doctor, I mean, see how well they speak. If English is Russian or wherever you're coming from, gauge their language ability. So a good conference call with the doctor is good. I mean, if it's a facilitator you're talking to, find out who will be assisting them in the hospital. Are the people that speak English? Do the nursing staff speak English? We work mainly a lot with Hospital Clinica Biblica. We make sure to have at least 1 or 2 nurses on the floor that speak English to the patient. We also have our coordinators who are back and forth in contact with the patient. So yeah, I think Deanna answered it great, and it's a great question. Any other questions? I don't know, Gil or Vicky? Okay.
Yeah. Also, we got a couple questions there actually, and guys, keep sending them. We might not be able to answer them all today, but we'll get to a couple of them. Bill, they want to know if they have visa problems getting into the country. What can the facilitator do? What can the establishment that they're going to? What role do they play in getting approved and not getting denied for that visa? How can we facilitate that process? That's what someone asked.
Okay.
Well, yeah. In our case, we deal in Costa Rica. We work with mainly North American, Canadian patients. They do not require a visa, so that's something we don't usually work with so much with the visa because it's not required, like I say. For countries, I know India, in most cases require a visa. So most facilitators, at least I've talked to, they do assist with that. So and you make sure if you're going to a country, check online to see if the country you're going to, a visa is needed, or the facilitator of the hospital should tell you. And oftentimes with the hospital, the international office, or the facilitator, they will help you expedite the visa or if you need a passport, that type of thing. Most facilitators can assist you with that as well.
Some people also require paperwork in order to place short-term disability forms and other things, letters from the physicians. So that's where, for example, in our case, we coordinate all that so that the patient gets it and has a smooth process getting all the paperwork ready.
Yeah.
Yeah, no, and I think, as you said right there, I think a letter from the doctor and things like that would definitely help, speed up the process and expedite the process. Also, someone asked if there's a complication that goes, that happens while they're on the trip. Does the facilitator help with that process, with any alterations of the plans, if the timeline is not met and things shift and they don't go as expected? What role does the facilitator play in that?
The facilitator can, sorry, carry on, Diana.
Thank you. It always depends on the facilitator you hire. We are not working anymore with a lot of facilitators. On our experience, we just have chosen the best ones. And the ones that we like to work with are the ones who cover the patient with an insurance. It is a complication insurance. Thank God we had never needed to use them. But if at some point some complication shows, then you know that you're covered, and they provide you with a list of the hospitals.
Bill, if you'd like to also touch on it, I think it'd be good as well.
Yeah.
Us as facilitators or as destination management, we carry on with our role in case of complications. We change the itineraries. We keep the companion and the patient company during their process, and we facilitate whatever documentation they would need for their medical tourism insurance or any other claims that they need to do. So we continue all step of the way. Every step of the way, we handhold them through the process until they recover and go home.
Yeah,
and even back at home.
Yeah, and as well as what Diana was mentioning, medical complication insurance, that's something that's an option, and we do offer it to patients, especially for higher risk procedures. So that's a very good thing to have, even though complications are very rare. But when they do happen, something like that is important. And in terms of some patients are from employers that we receive, the employer itself covers the complications. So it depends. But if you're a patient just on your own coming down, it's a good option to look for complication insurance, like Diana mentioned.
Yeah, and also they want to know more about, this is actually one, Bill, specifically to you, around your area or where you do business. I mean, are there any things they can do as far as shopping or getting outside the procedures? What's the office in Costa Rica as far as that destination?
Yeah, definitely. Costa Rica we receive, I think it's like 2 million tourists, especially for ecotourism in Costa Rica. So, we're in San Jose, Costa Rica. That's the capital. There's the country. You can get one side of the country, the Caribbean, to the Pacific in a few hours. So there's shopping, there's hotels, there's malls, U.S.-type malls near the hotels. You can go and buy trinkets, restaurants, and I don't know how you say that. Tourist things.
Souvenir shops.
Yeah, souvenir shops, craft shops, restaurants. There's type of restaurants you address as well. So that's all around the hospital area. There's tours, especially for the companion. They can go on and with a couple-hour tour to Volcano and come back. We even have patients going in wheelchair accessibility right up to the crater. We haven't had, I think only one fell. I'm just kidding.
Don't say that.
No.
Free approved tours from the physicians, even hip replacement, knee replacement patients, they get to go to the craters of those volcanoes if they want to.
Ideally it's the companion and the patient before the procedure, but in some cases, depending on the procedure, the doctor might allow the patient to do a tour, but there's a lot of things to do, shopping, restaurants, tours for the companion or the patient before the procedure.
walking distance even while the companion is waiting for the patient to leave the OR, to come out of the OR and all those things. 5 blocks away, they can find the National Theater, they can find a craft shop,
Yeah.
a bunch of other things.
Yeah.
No, I think those are good things for people to do when they're on their travels. I mean, I know a lot of people say they go abroad and they save a lot of money not only on the treatments but also on other things as well outside of that. So I think that's something that a lot of people like as well. You know, you want to go out there and get things done, but at the same time you want to have a little fun at the same time. So, Bill, I think that's pretty much everything for now. I really thank you guys for coming on and sharing this wealth of knowledge, as well as Addo about pharmaceuticals. Diana about Mexicali and what you guys offer as far as our materials concerned. So thank you everyone. Bill, if there's anything else you'd like to say, I think that pretty much concludes everything.
No, thank you very much. You know, it was a pleasure to be on here with Adele and Diana and Medical Tourism Association. We thank you for putting this important webcast together. I'm sure it'll be a help and value to patients looking for medical tourism. Okay.
Thank you for the opportunity, and if you have further questions, don't hesitate to let the MTA know.
Okay.
No, and I also, you'll be able to follow up with them if they have any other questions. Thank all the members. Thank you for coming out. Thank you.
Thank you.
Thank
Goodbye.
you, Bill, and Daniel, for all the help.
Hey.
Have a good day.
You too. Bye-bye.
Take care now.
Bye.